Ghanaian health authorities have consistently expressed concern about the fact that malaria remains one of the major diseases the country battles with for decades. In the Ashanti region, statistics show that malaria-related deaths are still being recorded. The Ashanti Regional Health Directorate, however, says there has been a reduction in the number of deaths due to some interventions they have come up with. Dr. Michael Roxaneji is the Deputy Ashanti Regional Health Director in charge of public health.
In 2019, the total deaths from malaria in our region was 31. We had 31 people, and most of these deaths were among children under 5. And then in 2020, it jumped to 42. And one of the reasons is that COVID-19 disrupted health delivery services for most parts of the year, at least up to latter part of second quarter. So health services were not very optimized in most of our communities. People presented late because they themselves didn't want to go and seek health care with the fear that they might contract COVID-19. So the death rate went up. However, because the health service restructured and repositioned its activities by training our staff and also building capacity, doing more education in the community, a lot more people sought health care. They went early. So the deaths dropped to 16 in 2021. And this year, we are looking at that. We'll bring it down further.
Speaking at a news conference in Kumasi, the Ashanti Regional Health Director, Dr. Emmanuel Tenkran, indicated that malaria imposes huge expenditure on the National Health Insurance Scheme, and as such, a lot more must be done to kick out malaria. It is in line with this that the government has provided mosquito nets to be distributed to all households in the region except Obuasi Municipality and Obuasi East District, as alternative arrangements have been made for those areas.
It accounts for 20% of our OPD attendants. So if we want our national health insurance to improve, the best thing we have to do is to make sure that we control malaria, to reduce the economic burden of malaria in this country. And that is the reason why we are undertaking this very important assignment. It's more preventive. You won't get sick. You won't waste money to go to hospital, and you have enough time to go and do your work. So economically, it will improve the country's socioeconomic status.
Dr. Emmanuel Tenkran is, however, warning members of the public to desist from using the mosquito nets for different purposes other than what they have been procured. He has described as worrying instances where distributed mosquito nets are used by tricycle waste collectors to cover refuse.
What is worrying is that anytime we do the distribution, we see that there's always misuse of some of the mosquito nets. I give example of some people using it to cover rubbish. These are Boboya people. And sometimes we see it and we feel so sad because we know the investment that has gone into it. For them, they don't know. So the advice is that when you take the net, you make sure that you sleep in it. Don't use it for any other purpose apart from sleeping in it and sleeping in it properly. Don't go and give it to Aboboya people to cover their rubbish. It's an insult to our program. And as I said, if I have my own way, I will arrest anybody who is using that for a purpose. Some of them, they use it for their garden, to fence their gardens and other things. We see it all the time. And as I said, it's an insult to us in the Ghana Health Service.
Now, within this 1 week period that the Regional Health Directorate will be distributing these mosquito nets, they want the general public to get involved to make this a success. For Citi News, I am Fati Amin Ibrahim, Kumasi.